they can give you some of that emotional support. Sometimes we sit there and there's nobody else to talk to. And that's a huge issue, is that, I think societally, we don't address those mental health and behavioral health concerns from a personal perspective. It's very easy to see it in other people. We can always pinpoint where other people need that support, but to take that on yourself can be difficult. And this allows an avenue to get some of that support. Not only can you get some of that coaching and counseling from your case manager, they can also help direct you to different community supports that you may not know are available to you that can provide some of that.
Welcome, listeners. It's my privilege today to welcome Nick. He joined Nova in 2014. Nick leads our health plan performance management team, and he is a math wizard. He holds bachelor's degrees in nursing and IT, which explains a lot. In 2021, he earned recognition as a supernova for all of the great feedback he receives from his colleagues. He's a translator. Nick and his team take intricate clinical detail and data and help us understand the story it's telling about the person behind the numbers and the impacts those numbers have on a health plan. His insight is invaluable.
So true. Welcome, Nick, to our podcast. I hope we did you justice with your intro.
Thank you. Very flattering. More than necessary.
Not true.
Humble.
So we're so glad you're here. And, you joined us for a webinar not long ago. So we knew that if anyone was going to be up for shenanigans and a podcast, it might be you. And we're just happy you're joining us. So before every episode, we share 3 questions with our guests. And you selected, what is something you've learned that's been so helpful? You tell everyone about it. So tell us.
All right. So this is kind of a little bit of a loaded question, because I won't say that I tell everybody this in general about our particular industry. However, it applies to our industry. And I do mention this to people as I cross it. And that is that your cell phone, your telephone, actually, you can make phone calls on it still, and it's amazing. And I say that because sometimes, and it applies to myself, even though I work in the business, and you go out and you're looking for a doctor, or you're going out and you're looking for a service, or whatever it is related to your healthcare, and we spend time doing, an hour or 2 of searching on our favorite browser to find out where we can find these things. But you could probably save yourself about 50 minutes of that time if you called your insurance company, because they have staff available that are experts in claims. They have experts in what your benefits are. They have nurses and medical staff that are there to help support you and guide you through your healthcare journey. And all it takes is a quick call, because I've watched myself do this. I've watched family do this, where we sit there and we try and solve it ourselves. We get on our phone, we get on our computer, and we search for this, that, and the other thing. We're not always going to be the expert. So how do we know exactly what questions we should be asking? Make that phone call. And you'll probably not only save a ton of time, but you'll probably get to the right answer that you're looking for a lot quicker and be more satisfied with the outcome if you make that outreach. So I love apps. Obviously, I have a degree in IT, and I'm telling you to go make a phone call.
Well, it's funny that you say that. And Jolene, I don't know if you feel this way, but I know that before I was in this role, that I even knew that case managers existed, or what the role of a case manager was. And given that we have local clients, and because, I have a Nova jacket on today, but if we're in the wrong space and somebody has that plan, they might ask you a question, or just be talking about something generally. And I have said before, like, have you talked to a case manager, or have you called the customer service line and asked to speak to a case manager? And I think you're right. That's like, did you know about case managers, Joe?
No, you don't associate them with your health insurance plan, right? Like, you don't think about it in that respect if you're not in the industry. So no, I did not know that before I started at Nova.
Yeah, I agree. And, I am, still am a nurse. Um, practiced more in that capacity prior to joining Nova in the more traditional capacity. And that was in 2014. And when I joined, that was the department I joined into. And before joining and before kind of investigating, exploring a new role in my career, then I really didn't have that insight either. I'm like, wow, this is something super valuable that most people probably aren't aware of.
So how would you explain so to someone who doesn't understand, because I feel this way a little bit, like if Adobe's not working, I really don't want to call IT. Like there just isn't time to have that conversation. And then the thing I'm saying is not really the thing that I need them to be working on, but I don't know the right language. So then I just don't call IT, and then I complain for like 2 weeks that Adobe's not working right. So I've created this vicious cycle. But I feel like the same thing is true with the insurance company. Like now that you've got chat with, a lot of organizations, chat might be easier. But even, if you can set aside the time to make the phone call, why would somebody benefit from calling and saying, can I speak to a case manager? Or I think I would be helped by a case manager.
Oh, perfect. I mean, chat is great. And I love chat, and a lot of the chat, features within different organizations, whether it be healthcare, whether it be in finance or whatever industry, a lot of them have AI built in. So artificial intelligence that goes through different logic that's built in the background that helps answer the question. There's really not a real person behind that chat. Some instances there are, and they'll help guide you through what you need. But the thing that you get from talking to a case manager versus, a chat, you do get that personal interaction. Typically, and I don't want to say exclusively, because obviously people have time off from work and people move on to different roles, but you typically deal with the same person over time. If you're on chat, that's great. Again, chat might be better served for a very quick question or something like that. But you start to develop these relationships with your case manager, and the case manager can help you not only, help guide you to what your options might be, whether it be from a treatment option, whether it be from a provider option, like I need to find a new oncologist, or maybe an oncologist is not who I need. Maybe I need a different specialty. They're experts in that. They know what they're looking for. They can give you some of that emotional support. Sometimes we sit there and there's nobody else to talk to. And that's a huge, huge issue, is that, I think societally, we don't address those mental health and behavioral health concerns from a personal perspective. It's very easy to see it in other people. We can always pinpoint where other people need that support, but to take that on yourself can be difficult. And this allows an avenue to get some of that support. Not only can you get some of that coaching and counseling from from your case manager, they can also help direct you to different community supports that you may not know are available to you that can provide some of that.
Everyone needs that roadmap. I think there's nothing more frustrating than having to retell your story over and over again, right? So here's my situation. What is the next step? So I think having that one-on-one and having somebody who knows the background and, even if it's noted in their file, is a huge plus, because you don't have an hour to spend on the phone calling 6 different people, so that's a great point.
Yeah.
Well, I think now I know they're registered nurses. They have experience in clinical settings, and the conversations they have with those patients when pre-pandemic, you would see notes on their desks from members about the difference that they've made for them in their care journey, or in supporting a dependent on the plan through their care journey. And I feel like that's the piece of it that you don't see until you're in case management and are able to really you don't understand the value they can provide if you can get into case management to speak with a nurse and understand really how, like, if you don't have a nurse in your family and you need somebody to say, here are your options.
Right. I think
I'm just always impressed with them.
Yeah, to that point, Sarah, I think that some of that is helpful. You mentioned and a lot of people may have this where they have a resource within their family from a healthcare setting. They may have a doctor in the family or a nurse in the family. But I think there's a big difference between having a doctor and nurse in a family and having a doctor or nurse in a family who actually works for the payer side of the house. Because they have a completely different perception. And, we're trying to assist the member in managing their benefits and what the best course for them will be, knowing what their benefit package offers. Your person sitting next to you at the table who might be a nurse is not going to have that type of knowledge. They may have a loose understanding of it, but they're not going to know the details the same way that somebody that works for the insurance company is going to have.
That's so interesting, because I feel like that's a perspective you can have, having sat on both sides of that wall in a clinical role, and absolutely not something I thought about.
Yeah. So, it's medical questions, and I still get those, and I haven't really been in direct type of practice in quite a time. But I rarely get the insurance questions because people don't think about it in that way. I think it is a mindset or just how you perceive things.
That the visuals don't show up on a podcast, do they?
Yeah.
Exploding head emoji.
That's right.
And I think it's not, when you say they think about the course of treatment according to your plan options, I feel like some of those recommendations come with the perspective of what are the best options available to you based on the coverage you have. So to make sure that they're getting the most out of the benefits they have before they maybe make decisions or choices that fall outside of the plan parameters, because sometimes that happens. Or understanding if you have to go outside of your plan, there are centers of excellence and things like that might, come into play there.
Absolutely. And I think that's a great approach to things, is that we have access to a lot of data. We have all the claims history data. We have all that stuff. So we have an understanding, and we actually have risk analytics tools and things like that can help guide as well. But the other thing that we have is we have databases of data that show us where the centers of excellence are. And these aren't just one person going out and saying, yeah, my neighbor had a procedure here and it was fantastic, or my neighbor went to this place and it was horrible. I mean, from a statistical part, and this is where I'll go on to the math side of my head, is that, a solid sample, a good sample size is not your neighbor. One person does not make a good sample for a legitimate study of what's good and what's not good. When you become a center of excellence, it goes through some rigorous studies. It goes through some rigorous criteria to become that center of excellence. Your person, working, that might be a nurse or a doctor that's not in the industry, they might not have access to understand what all of the centers of excellence are and which of those centers of excellence would be included with your benefit package. So I think, that part of it right there, we always like to say, my neighbor did this or so-and-so did that. I know they had a good time or a bad time, but that's not an adequate way to approach making life-changing decisions. You really want to make sure that you're asking the question of somebody who has access to mountains of data, knows how to parse through it and give you the correct answer. And that's really something that we can provide.
Yeah, that's like step one. And then step two is reading the reviews online, right? The Amazon reviews or Google reviews that should be step two in this situation.
Correct.
Well, it's funny because I was just, as you were saying that, I was thinking, that's exactly how I tried to find a contractor to help with the laundry room. I just asked my neighbors, I probably need a bigger sample size.
I mean, it may have worked out for you. I don't know.
No,
I mean, is your laundry room filled with water? I mean,
no, it's a mess. That's why I need a contractor. But maybe I should expand my search a little bit. Well, thank you, Nick. This was so good. So good. So this podcast is brought to you by Nova Healthcare Administrators. why did they let us do this? Sometimes we ask ourselves still. It's because at the end of the day, every Nova associate is really driven to do what's right. We want what's best for our clients and their members, and we do a great job sharing what we learn with each other. Between our colleagues and business partners, we know a lot of kind, smart, and thoughtful people that we convince to share their tips with you.
Don't forget to leave us a review, give us a like or subscribe, but more importantly, share. We'll find the insiders, you share it with the outsiders. You can find our podcast on SoundCloud or through Twitter at UNDR The Coverage.